Hi everyone, welcome to week 4. This week we're going to be discussing chapter 6, which is all about the sensory system. When you think of the senses, you think of touch, taste, sight, hearing, smelling. We're going to focus specifically on the eye and the ear though, vision and hearing in this particular chapter. So some of the things that you're going to be learning about are the different parts of each of these systems. So we're going to look at the parts of the eye, and we're also going to look at the parts of the ear. As with all of our chapters, the focus really is not only, becoming familiar with the parts and the structures and all of those things, but more so the disease states and the conditions that affect these things. So we're going to look specifically at the disease states and the conditions that affect the eye and the ear, and how we treat those things. So this is just a lateral cross section of the eye. As you go through the chapter, it's going to discuss all of these parts and how they all work together to help us see. So basically we've got rods and cones, and they are stimulated by light rays, and we have nerve impulses from the optic nerve to the brain, and all of those things together, along with reflective properties, allow us to see. And then of course we're going to be looking at the ear as well. So we've got all of the different organs of the ear that we're going to be looking at, and the ear is basically broken up into 3 parts: the outer ear, the middle ear, and the inner ear. So again, we're going to be looking at that specific anatomy, and these are some of the pictures that you're going to see in your textbook. Specifically, you're going to be talking about the things like the hammer, the anvil, and the stirrup, which are the bones, the little small bones in the ear that help us hear. The semicircular canals are very important when it comes to things like balance. We've got little tiny hairs in the outer ear, which are also part of the balance. And you'd be amazed at how, breaking off one of those little tiny cilia can affect someone's balance, and a lot of other things that go along with it. The eustachian tubes connect to the sinuses, which if you've ever had children with ear infections, you know that eustachian tube can bring infection in if they're having a cold, things like that. So those are all the different things you're going to learn about. First is the parts of the eye and the ear. And then we're going to get into some of the actual conditions of those 2 organs. So specifically, here's some of the conditions of the eye. Astigmatism is something you might be familiar with. Astigmatism comes from having an abnormally shaped cornea. So it usually results in, if it's not too bad, it results in, having to wear glasses and things like that. Cataracts is another thing you've probably heard of, which has to do with the clouding of the lens. A lot of times that happens with our elderly patients. Conjunctivitis is probably the most common condition in children. Conjunctivitis, another name for that is pink eye. So, but keep in mind as you're going through and learning about pink eye, that there is more than one kind. So there is pink eye that is non-infectious. I know most of the time we think of pink eye as being highly contagious, and it can be. But we also can have conjunctivitis as a result of allergens. So it's not always contagious. So kind of keep that in the back of your mind. Here are just a few other things. We've got the hordeolum, which is a sty. So you've probably seen people with styes before. Glaucoma, we've got nearsighted, farsightedness, all of those things that are associated with having to wear glasses. Night blindness is something that is fairly common. Extreme sensitivity to light, photophobia, is something that is sometimes a byproduct of some of the medications that patients take. So that's another important thing to remember as you're going through this. And then we have some of the conditions of the ear. Of course, we have deafness. We have all kinds of different types of hearing loss. We have impacted cerumen, which is just the excess wax buildup. Labyrinthitis is the inflammation of the inner ear. And that one is very actually one of the pharmacists that I work with who has been affected with this recently, and it's very debilitating. He can't even, I mean, he's vomiting, and he can't stand up and walk. All of these things, all from an infection of the inner ear. And then of course you have your otitis externa, which is swimmer's ear, and otitis media, which is the normal ear infection that we think of. And then vertigo a lot of times goes along with some of these ear infections. Learning the abbreviations related to the eyes and ears is very important. OD and OS and AD and AS are the most common ones that you're going to see. The O's relate to the eye, and the A's relate to the ear. So O is otic, A is oral or auditory. So that's how you can remember which one's eye and which one's ear. And then you just have to remember between D and S, which one's right and which one's left. So making sure that you know the difference between eyes and ears is going to be very important as you start reading prescriptions specifically. Now, the next part of the chapter is going to cover some of the different medications used to treat eyes and ears. One thing to keep in mind as you go through and you look at these, lots of different things here. You know, you're going to see a lot of these in the retail setting. Amoxicillin for otitis media. That's that pink stuff, if you're thinking of a liquid. And all of these are very important. But one thing I want you to keep in mind, when you see a prescription for a medication, a drop specifically, if it is an eye drop can be used in the ear because it is sterile. So it can be used in the eyes or in the ears. However, an eardrop cannot be used in the eyes because an eardrop is not required to be sterile. So that's a very important distinction to keep in mind as you're looking through these prescriptions through these medications. So if you have any questions at all as you're going through the material this week, please make sure you reach out to me. You can call, text, or email. My number is 618-792-2293. Have a great week.